Hello, my name is Nick Sadeghi, and today I'm going to be speaking about Clonidine. Clonidine can go by its brand name Catapres or Capve. It belongs to a family of drugs known as alpha-2 agonists. It's used most commonly as an adjunct blood pressure medication, but can also be used to treat ADHD as well as cancer pain. It works at a basic level by decreasing peripheral vascular resistance and thus lowering blood pressure. Clonidine has been approved by the FDA for uses in hypertension, ADHD, as well as cancer pain. It's used off-label for agitation, various uses in anesthetics, pain, and withdrawal. As far as administration goes, topically, at a basic level, we're going to want to apply a patch once every 7 days, rotating the location. And for oral uses, swallow the tablet whole, do not crush, chew, or break the tablet. It may be taken with or without food. For side effects of clonidine, we can see that there are a few, and they vary depending on body system. So I'll try and concentrate on the ones that studies show to be more common. Like, for example, in cardiovascular systems, hypotension and orthostatic hypotension seem to be more common side effects. For GI-related side effects, abdominal pain, xerostomia or dry mouth, as well as constipation may be side effects patients run into. For neurologic, confusion, dizziness, somnolence, just overall fatigue. For psychiatric, these can vary, especially depending on the indication which the medication is being used for. Respiratory, upper respiratory infections have been seen, as well as overall general fatigue. As far as more serious side effects go, these are side effects that we would want to have the patients contact their primary care right away, or if really serious, they should contact 911. Right here we have listed atrioventricular block. So if patients do experience this, they need to contact emergency help if needed immediately. Clonidine is essentially acting alpha agonist. It works by stimulating alpha-2 adrenergic receptors in the brainstem, resulting in decreased sympathetic outflow from the central nervous system and decreased peripheral resistance, renal vascular resistance, and thus heart rate and blood pressure. For ADHD, the mechanism of clonidine is not exactly known. And for epidural uses, clonidine works by preventing pain signal transmission to the brain at presynaptic and postjunctional alpha-2 receptors in the spinal cord. For dosage and formulations, clonidine is offered as a generic for epidural solutions, injection solutions, as well as oral tablets in immediate release and extended release, as well as an epidural solution brand name Duraclon, as well as an oral tablet brand name Capve. For the oral tablets, which we're typically going to focus on for our usage, they come in a 0.1 milligram, a 0.2 milligram, and a 0.3 milligram. In addition to the oral tablets and injectable solutions, clonidine also comes in a transdermal patch. These transdermal patches are offered in extended release in the concentrations of 0.1 milligram, 0.2 milligram, and 0.3 milligram, and these are 24-hour patches. For the specific dosage recommendations for clonidine, we're going to focus on hypertension. For the oral tablets, initially, we're going to start the patients on 0.1 milligrams orally twice daily, preferably morning and bedtime, and then, if needed, increase this by 0.1 milligrams per day at weekly intervals. The usual daily dose is 0.2 to 0.6 milligrams in 2 divided doses, with a max daily dose of 2.4 milligrams. When DCing these meds, gradually decrease over 2 to 4 days to avoid withdrawal symptoms. For the transdermal route, initially start at 0.1 milligrams per day, applied once every 7 days to a hairless area on the upper outer arm or chest. For titration, after 1 to 2 weeks, add another 0.1 milligram per day patch or change to a larger system, like the 0.2 or 0.3. For conversion from oral to transdermal patches, it's important to note that the antihypertensive effect may not take effect until 2 to 3 days after starting the patch, so gradual tapering may be needed. These are our dosage adjustments for clonidine. For renal failure, we can see that both oral and topical are effective in patients with chronic renal insufficiency as well as end-stage renal disease, although studies show that a lower initial dose may be beneficial. The same goes for geriatric patients. it's better to initiate therapy at low end of dosing ranges. Here are warnings and precautions related to clonidine. Clonidine may cause CNS depression, specifically side effects of sedation and somnolence. So it's important to let the patient be aware of these side effects and be able to recognize them if they do occur. This medication may be used in caution with patients with cardiovascular disease, cerebrovascular disease, renal impairment, as the elimination half-life may be prolonged, and then specific warnings related to the transdermal patch. Patients need to remove this patch before MRIs, cardioversion, defibrillation, as well as patients need to be aware of side effects related to localized contact reactions due to the patch being applied to the skin. Dry eyes, which is a common side effect, but it may be increased with patients that wear contact lenses. And patients also need to be advised to avoid abrupt discontinuation of the therapy. The only real contraindication to using clonidine is a hypersensitivity to clonidine or any component in the formulation. For the epidural-specific formulation, injection site infections or concurrent anticoagulant therapy are also contraindications to using this as therapy. For monitoring, this medication is being used to treat hypertension, so we have to monitor blood pressure, and that's in standing, sitting, and supine, the patient's mental status, as well as heart rate. These are my references. Thank you for your time.